Mr. President, Mr. Deputy President, Mr. Deputy Speaker, honorable members of the House, Mr. Prime Minister, Deputy Premier of Montserrat, representative of the Regional Council of Martinique, members of the House, colleagues, friends. This clearly is, the threat of Ebola is clearly a grave crisis facing us, but it also constitutes an important opportunity which, if taken and addressed correctly, can move us into a more protective mode of public health provision. I'll be sharing this presentation from the OECS angle with Dr. St. Catherine, who is a former Chief Medical Officer and our medical expert at the OECS. But I want to paint the context for you in terms of the efforts made by the OECS. We have heard throughout the presentations by the Ministry of Health in St. Lucia, they punctuated through this the importance of acting regionally. We are stronger together at the country level. We will be even stronger together at the regional level. No member of the OECS, no member of CARICOM can address this issue by itself. And that is why the question of regional and international collaboration is such an important dimension of this challenge. The OECS has not been sitting idly. From the moment that it became clear through international channels that the Ebola thing was becoming a looming potential crisis, national governments have taken action. We saw in St. Lucia and in St. Vincent, for example, the declaration prohibiting travel from crisis countries. We had OECS Ministers of Health meeting just last week, which agreed on the coordination of efforts across the OECS, a recognition that we need to ensure as a matter of priority that healthcare workers and frontline workers were protected in this battle, because in terms of the potential spread of the disease, they were the ones most immediately at threat in the containment of the disease. We agreed, therefore, that the regional effort at the OECS should not just be a coordination of those elements of the strategy that are best handled at a regional level for efficiencies of costs as well as efficiencies of expertise, but also in terms of each country supporting each other. Should there be the emergence of Ebola in any single OECS territory, it means that the entire configuration of the OECS, the other member states, would kick in with support to that particular country. And that is where the request by Prime Minister Anthony and Prime Minister Gonzalez on behalf of the OECS to the Cubans for the creation of a rapid response SWAT team is so important. We have seen, and I think people would be encouraged by the clarity and the self-assurance with which the Chief Medical Officer of St. Lucia presented the national plan. But the reality is that we do not have a history of experience and knowledge management in the treatment of such a dangerous infectious disease. The Cubans, on the other hand, have world-class expertise in that. Cuba actually right now has over 400 doctors and medical specialists on the ground at the heart of the crisis in Africa. And we were fortunate in the meeting in Havana a couple days ago to have met with the brigade of 97 Cuban doctors and specialists who yesterday went across to Africa and saw and was able to interact with them to learn for ourselves the depth of the expertise represented there. There was one professor of infectious diseases who had been on 6 missions to Africa. Most of them on average have been on 3 or 4 missions. What we are therefore seeking is to have a SWAT team, the composition of which will be determined by the Cubans, but it is agreed that it should be of sufficient number that they can sort of do rotation and be 24/7 attached to any case that rears itself. And that SWAT team be flown, because it will be based in Antigua, the base of LIAT, to be brought to any country where an Ebola case presents itself. Between the arrival, hopefully in the next week or two, and the possible emergence of any case, This SWAT team is going to be utilized by member states in training of, first of all, the national team, like the local Ministry of Health teams that was described here, but importantly, on the ground as well, in the training of the frontline healthcare workers, in the effective treatment of the disease, in the containment, in the safety requirements for themselves, and it is going to take the form of constant drill, simulation, and just as we have fire tests, fire drill tests, there will be that testing as well to test the preparedness of countries to respond with adequate precision to the emergence of a situation. In fact, it is interesting, Dr. Fredericks indicated that, spoke about the need to constantly monitor the situation with the international regulations and the guidance provided by PAHO. Long before PAHO, at least 2 or 3 days before PAHO had decided to change the requirements for the personal protection equipment, at the OECS and with the consultation with member states, we had already determined that the prescriptions of the international community with respect to protective gear was inadequate. Because the approach we've taken with the member states in shaping this plan has been not to work on a theoretical basis, but to work on the basis of actual scenario planning. So we look, for example, at the procedures, because the frontline workers are at immediate risk, what is involved step by step in the decontamination of those workers, and discover that in the procedures that PAHO and the international people had described, there was a flaw because of the steps in which Dr. St. Catherine can explain in better detail, but there was a flaw in the decontamination process, and we have actually plugged that ahead of PAHO and the others. So we've had this, following the health ministers meeting, we had a meeting of the ALBA heads of state in Cuba, and that resulted in a 21-point action declaration. Now, this is not your usual end of conference declarations of fluff. I believe it was indicated by the ministry that this would be a document of the House. You will see that the 21 points are 21 points of concrete action that are commitments by the ALBA states to provide the technical, financial, and mobilizational resources required to adequately contain any outbreak of this disease in the member states. So since the ALBA meeting a couple of days ago, what we've started doing as of yesterday is requiring of the national governments to indicate to the OECS who are going to be the 3 core leaders of the national team. And I believe St. Lucia has already submitted, a number of countries have submitted, but we're hoping by tomorrow to advise the Cubans of the composition, because on the 29th and the 30th of October, there'll be a technical preparatory meeting in Havana that will see those core team members from all of the countries gathering together. We're talking about top medical personnel to revise the national plans in the context of sub-regional and wider regional containment plans, and to refine those things, out of which will come a complete specifications of the material requirements to support and safeguard the efforts in each national space. An important element of that will be, as I said, the training of trainers and the rollout of that training. It will also involve looking at the protocols that will be developed. St. Lucia, you heard, is developing its national protocols. At the OECS level, we'll be assembling the technical officials to revise all of the national protocols to ensure convergence of process and synergy between those national protocols so that we can all be on the same page in the OECS. The plan that came out of the OECS ministers meeting identified 5 major points of action: a prevention strategy, and there are details to that Dr. St. Catherine will speak to, protecting the health and front-facing workers, which is, as I said, vitally important. Thirdly, managing Ebola cases should they emerge, and managing public perceptions. A major thing in this is the management of public perceptions, because it is true that Ebola is a potential threat. However, if we were to go by CNN reports on Ebola, we can be very misled, because you will know that Ebola has been in Africa since the 1970s. We have not heard much about that. It just takes 2 Americans to fall sick, and suddenly it's a major crisis. So the public perception is important, because I'm sure members would also have seen on television a report on the BBC where there was this, I think it was a Nigerian nurse in training who treated 5 members of her family using garbage bags to create her own protective equipment, and 4 of them were saved, 1 died. What this says to us, I mean, as much as we saw how sophisticated the PPE gear is, and there's even more sophistication being added by WHO and so on, what that says to us, that African experience, is that while the protective gear is important, what is even more important are the processes of decontamination that you use in order to safeguard yourself. And that is why the training, the drill, the simulations with our healthcare workers are going to be so critical in that containment. I spoke to the Cuban Medical Brigade. In terms of assistance, therefore, we are leveraging the diplomatic relations of the Oecs with all of the diplomatic relations to see how we can obtain specific assistance from different partners. We've alerted, for example, the British High Commissioner, who just presented her credentials last week, about the efforts being made by the Oecs in support of the ALBA countries so that agencies such as DFID can be on board. The President of the Caribbean Development Bank has already signaled to the governments his readiness to, the bank is in readiness to receive any requests made by member states and to provide the support required according to the modalities that are possible. So to the extent it will be grant financing, to the extent loan financing, this is a crisis, and we have to find the most creative means as well as the most affordable means of making this happen. PAHO and WHO have kicked in with their support at the ALBA level as well as at the level of CAFRA. There is going to be access to the more sophisticated technical resources that we require, that the different categories. Dr. Catherine will speak, St. Catherine will speak to this, but there are certain categories of laboratories that deal with different levels of escalation of the disease, and that will be addressed. You were advised by the Minister of Health that Martinique is now a member of the Oecs. The formal signing of the accession will take place at the Oecs heads meeting in November. But given the fact that the heads had already approved Martinique's coming on board, and with the unanimous vote of the Regional Council, we are effectively treating Martinique as an associate member. So they have been part of the meeting of the health ministers meeting. They are represented here today. We know of the excellent collaboration that pre-existed with Martinique and St. Lucia in the area of health. The accession to the Oecs now opens even wider doors of possibility for collaboration. While the focus of this Honorable House today is on Ebola, I must also take the opportunity to advise you that the meeting of Oecs health ministers looked at both the present problem of chikungunya and the future possibility of Ebola. And a plan has also been formulated with respect to the addressing the ongoing problem with chikungunya. The Martinicans in this regard have tremendous expertise to make available to us. They indicated that at the high point of the chikungunya problem in Martinique, there were 70,000 cases, and they were able within a period of 2 weeks to see significant reductions because of the public education and action strategies that they undertook. There was a day of destruction of mosquitoes, where from school children right up to the level of the state, a complete clean out of all sources of breeding and so on, and they saw the results in the cases. Which is why I said earlier that this crisis is also strategically an opportunity to reposition our mode of delivery of public health, because people have to understand that public health exists at many levels. It's not just a responsibility of the ministries of health, it is also a responsibility of individual citizens, of communities. We need to change many of our practices of sanitation and waste disposal, etc. If you look carefully at the TV reports, the most virulent situations in Africa with the Ebola. You just check out the sanitation around those areas. You will see, I mean, any kind of disease can breed in that condition. So we need to pay attention to that. With regard to the other diplomatic relations, those countries, for example, who have links with People's Republic, those who have links with the Republic of Taiwan, with other countries, Western countries and so on, we have putting out feelers with respect to testing kits. The Chinese have testing kits for the detection of Ebola, field isolation units. In addition to the efforts being made at the national level, we feel that the OECS should have a responsive capacity with field isolation units. These are tents specially designed and configured so that if there's a wider outbreak, containment can happen in any place that it occurs. The question of the personal protective equipment, drugs and decontamination supplies. The pharmaceuticals procurement unit of the OECS is already at work in identifying those sources, and we're doing so much in real time. Chief Medical Officer of St. Lucia will need to liaise with the pharmaceuticals unit with regard to a cheaper procurement model, because with the procurement of regular drugs, we save 40% to governments on the procurement. In terms of the strategic possibilities, we are also using this opportunity. There was a statement made with respect to monitoring of cases and, you know, getting public information out there. We are a highly penetrated, the OECS, a highly penetrated region when it comes to mobiles, and we are looking now at crowdsourcing the creation of appropriate software that can be used to monitor the disease, to crowdsource reporting, to track cases, persons who may have been cleared, but you want to know what their movements are and be able to send text messages to them, public messaging through mobiles. That is being worked on. This would be perhaps a lasting legacy of this crisis that can help for more effective, because today it's Ebola, tomorrow it will be something else, right? Infectious diseases are on the rise. I spoke to the redesign of public health practices to move to preventative rather than curative modes. The question of leaving behind also an infrastructure for addressing such crises. And one of the things that at the OECS we have already put feelers out is seeking to get scholarships for tropical medicine and infectious disease control, so that we have the local capacity, the indigenous capacity to deal with that. And finally, with respect to the fundraising stream that the Chief Medical Officer spoke to, again, coming out of the OECS Ministers of Health meeting, there was a proposal which was endorsed by the health ministers, but which now have to come to the heads of government of the OECS for a levy, visitor fee levy, that would be dedicated to healthcare. Now, this is vitally important, and I know the tourism people may perhaps raise an issue with this, but let me say that one of the scenarios presented, and you need to carefully consider that, honorable members, is that St. Martin, which is proposing to participate in this, has a population of about 50,000 persons. But on an annual basis, St. Martin sees 3 million cruise ship visitors and airline passengers coming through. So this is a huge carrying capacity. And if you put that in the context of the ease of spread of infectious diseases, then you see why it is really important that we take these protective measures. I will ask Dr. St. Catherine to speak to the technical details of the OECS position.